This patient's about to crash. Do you know what they have? If they come in with a high fever, stiff neck, and photophobia, what disease is this? Hope you know and you don't kill your patient. That is meningitis. All right, meningitis is very highly testable on the NCLEX. We're going to go over the top 5 things that NCLEX loves to test on. The last one is the most important, so please hang on. Meningitis, today we're going to talk about the bacterial meningitis. It is an infection of the meninges. Those are the protective covering around the brain and the spinal cord. So patients will come in with usually a severe headache. Now, they will not say stiff neck on an NCLEX. They will say nuchal rigidity. Nuchal means neck. Rigidity means it's stiff neck. Photophobia. Photo means like eyes, right? Picture. Phobia. It's a fear. So the light really hurts their eyes. They come in with the high fever, and oftentimes, especially school-age kids, will come in with seizures, okay? What is the 2 tests that we run for meningitis? They're 2 dudes' names, as always, okay? And we do these 2 tests to determine if they have meningitis. That is Koenig's and Brzezinski's. You have got to know these for meningitis. These are 2 tests that we do, all right? What is your number 1 priority for meningitis? If they ask you a priority question on NCLEX, what is the first thing that you're going to do? Boom, we're going to do precautions on our patient. Droplet precautions. You've got to protect yourself and the people around you. So precautions is first. Number 2 is to get antibiotics started as soon as you can because the meningitis is eating away their brain, all right? It is important to diagnose with the lumbar puncture. We like to get the lumbar puncture before antibiotics, okay? Last very testable thing, who do we never do a lumbar puncture on? If we think our patient has this, you should never perform a lumbar puncture. And that is increased ICP. If we think they have increased ICP, do not do a lumbar puncture, okay? And increased ICP is very much at risk with meningitis. If they have very high increased ICP and then you poke a hole in their spinal cord, it can suck the brain right down the spinal cord, and then you cause a brainstem herniation and the patient has simply passed away, all right? Do you know the most testable things on meningitis?